Hello, everybody, and welcome to another Ideas by Interpreters webinar. We're excited to have you here. Today, we're going to be speaking with Natalya Mytareva with CCHI, which is the First National Healthcare Interpreter Certification. They're going to be talking about the summit that they're going to be having in October. So, Natalya, thanks for joining us, and I'll let you take it away.
Welcome. Hi, everyone. I'm extremely excited to be here today, and thank you, Caroline. It's been a pleasure. We've been talking quite a few times by now, and I'm excited that we can share the information about the summit and why we have it and what does it mean for the profession of medical interpreters. If in case some of you don't know, CCHI, the Certification Commission for Healthcare Interpreters, is a national certification body which administers certification programs for medical interpreters in the United States. And our mission for the past 10 years has remained the same: to administer and develop national valid, credible, and vendor-neutral certification program. We're the first and we're the only accredited program in the United States by the National Commission for Certifying Agencies, which accredits certification programs for many professions. When we gathered this year as the Commission to plan for what we'll be doing in 2019, we wanted to have an event that would be a proactive conversation with everybody in our profession and our industry. One of the principles of our certification is that of inclusiveness, and the other one is of fairness. And through every step of our programs, we want to make sure that we include everybody. And while you see us, when we go to interpreter conferences, you hear us at webinars like this one, there is still some groups of stakeholders with whom we interact very consistently, but not maybe in such a public way. And we wanted to make sure that we have an event where everyone is invited and everyone can participate and represent their group, their interest in medical interpreting and in healthcare interpreting industry. The need to have this dialogue, to have this conversation, comes from, for us, from the very foundation of our program and exams, because our CCHI's programs exist to reflect the current practice of medical interpreting. We do not create that practice. We obviously influence this because we participate in it, but our main objective is to reflect it and to set the standard to measure against which the interpreters could measure their competencies, and employers could also evaluate their employees. So who defines the practice? Because again, CCHI does not define it, but who defines the current practice of medical interpreting? Well, of course, the number one group of stakeholders which define the practice is interpreters, because by doing the job, you are creating the legacy of how the job should be done. And by joining the associations, you create the rules, the standards of practice, the codes of ethics that inform other individuals who want to join the profession and how our profession functions. So the interpreters have a very specific interest in how the practice of medical interpreting takes place in the United States. But they're obviously not alone, because they exist because their services are needed. And that's why the second group which influences the practice of medical interpreting is the consumers of interpreting services. And I group them here together, even though they obviously represent two different groups, healthcare providers and patients. But from the interpreter's perspective, these two groups of stakeholders are equal because we are interpreting for both sides, and we keep neutrality and impartiality to make sure that both sides can communicate with each other with our help. Of course, because as a professional, we need to get some education. We need to learn how to be an interpreter first. There are a third group of stakeholders which influences our practice is interpreter educators. And their influence is pretty direct. If there are no interpreting schools in a country, then there will be no professional interpreters, because professional interpreters are not self-claimed individuals who just encourage everybody just to believe in the fact that they know what they're doing. These professional interpreters are the ones who have completed certain education in the language and in the specific skills of interpreting and in the specific setting, in this case in medical interpreting. And of course, we're narrowing even it down more for by adjusting to the United States, to the country. So these are the three pillars of our practice, and of course the practice won't exist if interpreters are not able to be paid for their job. And the employers of interpreters are the ones who represent the fourth foundation or pillar for the current practice of medical interpreting. And here I mentioned language services company, but of course to the same, if we want to look at this group at a broader level, it will also be hospitals and health systems which hire staff interpreters, because even though they have slightly significantly different approach to utilizing and seeking interpreters, but ultimately to the interpreter, they're their employer, be it through contract, be it through employment contract as a staff person or the freelancer. But ultimately, this is the group that also affects our practice in terms of many things. Can we make a living as an interpreter? Are we required to meet some other criteria? Are we required to get some specific education, and so on and so forth? So because the practice is informed by these four big groups or interest groups, we as a certifying entity are obligated to take into account the views of each of these stakeholders. And we do it in different ways. The way they and the practice influences us first starts with the eligibility criteria. In other words, when CCHI decided to start a certification program in 2009, the first conversation we had was who we will decide is eligible to take our examination. And to make these eligibility criteria, we needed to look at the current practice at that time, and then each year we're actually revisiting the same question over and over again to make sure that the eligibility criteria didn't change. And I'll talk about that in a second in more detail. The second aspect, which is influenced by those stakeholders, is our exam content. And again, I'll talk about that in detail. And then the third one is continuing education requirements for already certified interpreters. In other words, all these three major aspects of our work as an organization, they are informed by the current practice and by the stakeholders who create that practice. So let me explain why and how eligibility criteria are informed by the stakeholders in the profession and the industry. And again, I'm using this, phrase profession and industry because if we talk about the healthcare interpreter profession, then we're mostly talking about interpreters and interpreter trainers, the two sides which define what it means to be an interpreter. And when we talk about interpreting industry, we're talking about consumers of the services and entities that provide or resell their services. So it's more of the economic term than the professional definition term. So back to the eligibility criteria. The first criteria we have is in order to sit for a certification exam, a person must be at least 18 years old. And it seems a very straightforward and reasonable requirement. However, we have arrived at it by conversing and reviewing the current practice of interpreting as it existed 10 years ago by now. And if some of you on the call remember, at that time, it seems that we, as in maybe a little earlier, maybe in 2004, 2005, we as a profession came to the consensus that children should not interpret. And we kind of had to create that definition of what children means, meaning that the individuals who are mentally and personality-wise prepared to perform the job of an interpreter must be at least 18 years old. And there's no law which is written anywhere specifically. Each state may have specific guidance as far as the age of interpreters, but there is no like one place that I can point to you, look here, here's the link, which says you have to be 18 years old. So CCHI, by creating this eligibility criterion, which is based on the reality of interpreting world at that time, kind of established that standard and established that law. So now anybody could reference is like why a person who is 16 years old should interpret. Oh, because they cannot get even certified. And if they cannot get certified, no one can test their skills, and that's why they're not qualified to be an interpreter yet. So even though it's a very small aspect, but it's a very important one, as you can see, to create that legacy and written standard that is national and that is adopted and recognized. If we put here 21 years of age, I don't think the field would have been as accepted, right? We cannot, as an organization, just cannot come up with our arbitrary criteria. That 18 years old came through the, as I said already, review and conversations with the stakeholders. The education requirement to have at least a high school diploma. Well, there are two ways of looking at it, too little and too much, right? Let me start with the too much. Some individuals may argue that having a high school diploma is just too high of a standard because if you look at the rest of the world, not all people in the world have the ability to get high school education, especially if we're talking about refugee populations. And that is true. However, because we're interpreting and because language is a very complex neural phenomenon, and because we're interpreting in healthcare, and healthcare in the United States specifically is based on Western biomedicine, which means that any interpreter working in the United States in healthcare will have to interpret conversation that has some component dealing with science. And that is something that is taught at high school level. So if an interpreter does not have the general background, general exposure to sciences at all at the high school level, they simply will not be able to understand basic concepts. And those basic concepts could be such concepts as virus, bacteria, weight gain, all these things that could be also very cultural, but only an individual with a minimum of that knowledge will get that full understanding. Now let's look at the other aspects of people saying, well, high school diploma is too little. And when we established the standards, we surveyed the stakeholders, we had conversations, and here what kind of ruled our decision to accept that criteria was the fact that we need to be inclusive and fair. And interpreters of many languages, especially indigenous languages, especially interpreters of refugee languages, will not have an opportunity to obtain education beyond high school level. Even high school level for them would be a significant achievement, and that's where we put our minimum bar. But we cannot raise the bar too high that we will end up with certain language groups and patients by that token removed from the process of certification. So again, every year we evaluate this criteria and make sure that we're still at the stage where that is true. And still there are whole language communities where education beyond high school level is not as readily accessible as to the other communities. Then the third requirement is training. How long does it take to become a medical interpreter? Obviously, it's not 40 hours, but we had to put some criteria recognizing that healthcare interpreting is an intersection of two fields, interpreting per se, right? You could interpret in court, you could interpret for conferences, for education, and also intersection of healthcare. And recognizing that we cannot really ask how long will it take to an individual to learn interpreting. We focused on identifying the minimum amount of hours that is available at that time to any reasonable candidate if they want to become certified. And that came from the 40-hour trainings that existed 10 years ago. At that time, there were pretty much just two of them, bridging the gap and the community interpreter. I don't remember if that was still called that, the community interpreter. I think so. But what we hear constantly is some questioning of why is it just 40, why is it not 60, right? But then we ask, and then why is it not 120, right? Why is it not 3 credits from the college, which is for 45 hours? So all these decisions, they are informed by these conversations. And the conversations we have in different ways, through online surveys, through going to conferences, participating in panels. But because 10 years has passed since this criteria were established, we felt that this is an opportunity to start an open conversation discussing this criteria and getting the feedback from all stakeholders. And that is one of the reasons that we decided to hold the summit this year. And the fourth criteria is language proficiency requirement. That's a fascinating topic of what we should consider acceptable as proof that the person speaks language X and English. And that's a conversation we also hope to have at our summit. Now, the second part of our dependence on the current medical interpreting practice lies in the creation of examination content, the actual questions for our exam, the actual scenarios that interpreters have to assess or interpret. And that comes directly from our accreditation status. Because according to the best practices and the requirements for accredited professional certifications, be them for nurses, for doctors, for attorneys, or for interpreters, these requirements are the same. The first one is that all examination items must be written by subject matter experts in the field of practice. In other words, in our case, it will be healthcare interpreters. So what that standard means is that we, as an organization, cannot just get together and sit down and write the questions. That will not meet the accreditation criteria. That will be a good thing. That probably will be a good exam, but it won't be a national certification exam. The second requirement connected with it is that that panel of subject matter experts needs to be representative of the field and the population that will be certified. In other words, there should be some controls during the recruitment and the actual involvement of those subject matter experts that would prevent undue and disproportionate influence of any individual group. And for every step of our test's development, for writing items, for reviewing them, for validating the actual test forms, for deciding what would be the passing score, it's all done by practicing interpreters, not by us, the commissioners. We facilitate the meetings of them, but they, as a group, come up with these steps in our exam content development. And when these groups are convened, we want to make sure that they represent different languages, different employment statuses, meaning freelancers, full-timers, part-timers, different settings that people interpret for, hospitals or public health or health insurance plans, different time frame or duration of their interpreting in terms of experience, whether they're interpreting 2 years, 10 years, 5 years, or whether they're interpreting less than 2 hours per week or 40 hours per week. Because all of these different subgroups of interpreters are different, and when we create our exam, we want to make sure that it reflects the practice that exists for everybody. So these individuals, when they get together to decide on the content or what the passing score should be, they need to come to the agreement that they all agree, yes, that would work for everybody. So again, the exam creation comes through this consensus building way of writing the actual content. And then the third requirement for accreditation is that each item must be validated by SMEs, but also must have at least one verifiable reference. And this is where we as an organization have to rely on trainers who produce textbooks, on associations who produce codes of ethics and standards of practice, because for each question, we need to justify what is the correct answer. We literally have to put the page number. When we create the dialogue scenarios where, for example, a doctor and a patient speak about tummy ache of a baby, we need to make sure that when the subject matter experts say that tummy ache in Spanish could be said this way, and this way, that we have also references that they're correct, and that the word tummy may be interpreted these different ways. And of course, language is a moving organism, an evolving organism, so our raters consistently have to go back and build additional guides on how these specific words could be interpreted. But what I'm trying to convey you that the exams are written by interpreters with the information from interpreter trainers, from interpreter associations, and from healthcare providers, because we cannot really write scenarios out of our head without having the ground in the actual medical practice. We cannot come up with some treatments that don't exist just for the sake of having some linguistic difficulty, right, or ease of it. So it's all comes together only because of the stakeholders. And then the credential renewal or certification renewal policies. As you may know, the certifications are valid for 4 years. The reason there is an expiration, again, comes from our accreditation body. The requirement for best practice for all certification is for it to expire. And then there are different mechanisms. You either take an exam again, or you could do what we decided to do as a commission, is to require continuing education hours and work experience hours. And the number of hours, obviously, is hard to come up with. Again, we had to meet with the stakeholders, with the certified interpreters, with the trainers. We needed to make sure that we don't create a requirement that is too hard to meet. For example, if we put, let's say, 100 hours, and there are not that many training programs in the United States for every certified interpreter, right? Because we cannot base this policy on interpreters working in a hospital who have more opportunities to participate in continuing education because they're more exposed, let's say, to education available for nurses, doctors, etc. We cannot base this requirement just on interpreters of Spanish, Arabic, or Mandarin, or Russian, which are the frequently used languages in the United States. We cannot base this requirement just for interpreters who live in Chicago, San Francisco, or Kansas City. We need to think of interpreters of languages as Kinyarwanda, Mon, Karen, Nepali. We need to think of interpreters who live in rural areas, and for interpreters who are freelancers and who work not just in healthcare but in court interpreting and deed translations, etc. So again, to come up with these things, we needed to think of all these aspects. And when we had the drafts, we went back to our advisors, and some of them would say, "Hey, did you think of this? And did you think of that?" So this is informed again all by you, by the practice, and to get the information of what should we do in the next 4 years. We need to we decided that we would like to have an additional mechanism, which is a meeting where we could truly discuss different aspects of the healthcare interpreting practice, of the healthcare interpreting industry and profession. And by having this conversation, by engaging everybody, we will be able to learn ourselves and start planning the next decade for certification. So the objectives that we have for the summit is to identify the current issues that face all of us, and maybe start laying out the future paths for certification development and the future of the profession. We understand that after one day meeting, we're not going to have like, here's what we need to do, right? But maybe we could come up with the idea that, these are the major issues. They could be hosted by existing organizations, right? Either associations of interpreters or trainers or language companies, or maybe if there is no place for them, maybe we should create an inter-stakeholder work groups that will start thinking through these issues, and they would, as neutral entities, coalitions, collaborations, will then inform all other stakeholders of what is it that is necessary to achieve success for each of the sides involved. Because again, for many of the stakeholders have competing interests, and we recognize that. And we want to provide that safe place where interpreters could voice and identify their pressure points, their pain points. I can pretty much name you several right off the bat, from interpreter pay through finding the time for continuing education, through support for vicarious trauma exposure, etc., etc. We want also to make sure that we know what are the pressure and pain points for healthcare providers, and be it health systems or hospitals as an organizations or individual doctors, nurses, because again, they have the different interests, and they want to make sure that they perform their jobs correctly, and how would they interact, what they want of interpreters and language companies. We want to see how patients, family, and communities of the languages for whom interpreters interpret, what their needs are. And here, these two groups closely meet, both healthcare providers and patients, on the issue of language access. So that would be the focus of one of our conversations. Then, of course, language service companies. They have a whole set of their issues. On the one hand, they want to make sure that they hire the best interpreters of every possible language, certified and able to do multiple types of jobs in multiple settings, but they also want them to be available 24/7, right? And they also want to make sure that they actually exist and make some profit. So when they converse with the healthcare providers, obviously they want to make sure that they're selected over their competitors, etc., etc. So, but because they are the core of the industry between healthcare providers and language companies, that's where the financial foundation of our profession of language access and of the interpreting coming from. It's important to hear the issues and to involve them in helping resolve ours, but also help them be successful. Interpreter educators. If we, as a profession, really want to be on par with nurses and doctors, what needs to happen, right? Doctors and nurses go to colleges. They need to earn a degree. We're still not there. We have many more community colleges that offer interpreting certificate programs. We have a couple still that offer bachelors. And we pretty much only are speaking about Spanish or language neutral. But even if you want to become um, Arabic or a Russian medical interpreter in the United States. You cannot just go to college and become one. And until that is a reality, we won't be equal as nurses because any child which in America decides to be a nurse, they just go to college and become a nurse. So talking about educators and their pressure points is very important to see how we can push the whole training industry forward so they could meet the needs of us interpreters wanting to become more professional. Interpreter associations. 20 years ago, 10 years ago, when associations started to form and started to have their conferences, the main goal was just to find similar-minded professionals, right? Now we are at the stage when these are the opportunities for us to get continuing education and to learn about the new trends and to network. But what would be their role in 10 years from now when we'll all be probably just completely virtual and don't want to see each other, right? So, but how would they move to these online modalities? Certification bodies, as I already mentioned in detail from the beginning, we have our own interest. We want to make sure that our exams reflect the reality, and we want to make sure that we exist for a long time so we can continue that standard for the profession and the industry. Technology company, because language is at the core of the interest for many technology companies, and I'm talking Google, Facebook, um, uh, Amazon, and Buslingo as a platform, they have their own interest because they could give us so many different things. They could enhance our job as interpreters by giving us the tools to learn faster, to be more effective. They could give the tools to our consumers, health systems and hospitals to, how they're accepting their interpreting services. They can give tools to language companies, to trainers, to associations, to us, how our exams are built and presented. So if we ignore that they are a stakeholder in our profession, then we may disappear because the future is for those professions which embrace technology and adapt it to its need and work close together. And I know many of you have friends or relatives who are involved in technology industry. You know how the brains work differently than ours, right? And we need to make sure that we understand them and they understand us, and we are at the same table from the very beginning of this thing. And then last but not least, public at large. We do not exist in a vacuum. We exist in the United States. We exist in the world. And we all have a responsibility to act accordingly in front of the public and maintain our values as society. And that is also an important thing, that whenever we create certain kind of policies on our end, speaking from the certification body's perspective, we need to make sure that we follow all the regulations, that we do not inadvertently discriminate, that we do not create the hardship for the public by creating something good for interpreters, right? Because we have the responsibility to the public to say that certified interpreters are the ones who can actually do the job. We can guarantee to the public, not just to all the other stakeholders, but to the public, that they can trust that credential. So as you can see, these kind of interests are very different and yet we have lots of in common. And for that reason, we are planning to meet for one day of conversations, of interactions. We're meeting at the Alina Health Commons in Minneapolis. And we're very grateful for Alina Health for sponsoring this event as the venue sponsor. And at the same time, we also realized that to any venue, there are limitations. And for us to have a conversation, we cannot have 4,000 people present physically, right? I mean, we probably could, but that would be logistically still too hard and too expensive, because even though our registration fee for the summit is only $10, thanks to our sponsors, it still includes travel for many people. That's why, in addition to the uh, on-site activities, we have this summit available online. And that's also thanks to all these technology companies, right? So without them, that would have been impossible. If you're interested in participating in the summit, I want to mention that the on-site registration is already closed. We're going to have about 180 individuals on site, and we'll be streaming live the plenary sessions, and I'll go over them in a minute because they're extremely interesting. But then we also have the online participation in an interactive manner. Where the participants could share their webcams if they wish, or just the voice, and discuss the same issues that we will be discussing in this room. So, who are our speakers? Well, first I want to talk about our Master of Ceremonies, Ignatius Paul, a colleague, a friend, longtime supporter of CCHI. If you don't know Ignatius, I hope that by watching the summit or participating in it, you will understand how invaluable his role will be. He started his career as an immigration and civil rights attorney. He worked in many consulting positions for minority health advocacy organizations at the state and the national level. He was a program officer for the California Endowment. He supported the California Healthcare Interpreting Association from its beginning, the National Council for Interpreting in Healthcare, supported CCHI, as I already mentioned, the National Health Law Program, but also he was an advisor to different committees for U.S. Department of Health and Human Services, Office of Minority Health, Centers for Disease Control and Prevention, and Office for National Coordination of Health Information Technology. In other words, a unique individual who has embraced the depth and breadth of the healthcare system in the United States, and had a large enough heart to have the place for interpreters, because he's coming, as you heard, from the point of view of underserved and the healthcare professionals. So we're very lucky to have him throughout our event, navigating us through different stages. Our keynote speaker is Mara Yudelman, our first chair of CCHI and a founding commissioner. She's the managing attorney at the National Health Law Program, which is an advocacy organization for the rights of individuals to healthcare in this country. So we're very happy to have her talk to us about the current policies, about what is happening. It'll be very interesting because remember, it'll be October. We just all submitted our comments about new proposed limitations on Section 1557 of the Affordable Care Act. So it'll be really interesting to see what Mara could share with us in October after the administration will already make a decision on this rule. And our second keynote is Johanna Parker, who is a staff interpreter, lead staff interpreter, and an interpreter trainer at Stanford Health. And Johanna is a unique position, who is an interpreter of like many of us, with wearing different hats. She's a court-certified interpreter. She was trained as a conference interpreter by Middlemer Institute for International Studies. She is a certified healthcare interpreter in Spanish. She's also adept in translation. She does multiple presentations across the country for court and medical interpreters. So we would like to hear her perspective on the current situation in our profession, on how being a Spanish interpreter with this opportunity to see different sides makes you think of where the future would be for us. She will set for us the stage to go into the conversations which we'll be having. In the morning, we'll have the first panel with the founding commissioners and the current commissioners, reflecting on the importance of certification and the role of certification 10 years ago and moving forward in the future. Then there will be the most interesting part, from my point of view, of the summit, where everybody will be discussing the most urgent issues experienced by us. So we will divide the attendees into the following topics, and the same topics will be discussed by the attendees of the online summit. Professional challenges for interpreters, language access and policy challenges, challenges for training of interpreters, challenges for language services companies, challenges for associations of interpreters and translators, technology in interpreting and for interpreters, and future paths for interpreter certification. At the end, each group will hopefully come up with some either visual or bullet point presentation of what those challenges are. We'll then, share their findings both online and briefly at the summit. And based on these notes from this conversation, we will hope to shape the work for the whole field in the next years. And we'll finish the day with a second panel, which will discuss the same issues, but more from their own professional perspective. And I don't know if you recognize the faces. There are 11 of them, so I couldn't fit the names also, but many of you probably recognize Cindy Roth, who is our trainer and consultant and developer of many interpreter training curriculums. We're also lucky to have Fred Bambongi, who is the Vice President for Access at Alina Health. Christine Quinlan from Certified Languages International will talk about the perspective of the language company, so is Mila Galavin from Masterword Services. Then we have a perspective from another perspective from a healthcare system from Tim Moriarty from Bay State Health in Massachusetts. Jose Garcia will represent the view of the associations as the former longstanding president of CHIA. Have a number of the trainers, and that's really is we're really lucky to have them. In addition to Cindy Roth, we have Zarita Araujo Lane from Cross Cultural Communication System, Marjorie Bancroft from Cross Cultural Communications, the authors of the Community Interpreter Training, and Richard Lorian from St. Catherine's Institute, representing the Katie Center for Sign Language Interpreting. Last but not least, we have Catherine Allen, who has this unique perspective as the co-founder of the Interpret America organization that looks forward into the technology part of it, and Bill Rivers, the executive director of the Joint Commission for National Languages, will represent and inform us about the perspective of the professional lobbyist for us, for the language professionals at the with the government, with the Congress. So it'll be a very interesting conversation to which I look forward to learn it. As you see, this is not going to be a conference. It would be a series of conversations, either among people from which we would learn or amongst ourselves. And I hope that we're able to capture all that. We will reveal our sponsors soon, but I'm definitely very happy to reveal one sponsor today, Buslingo. Thank you very much for your support, because again, without sponsors, without generous donations, we will not be able to have this event available in two modalities and affordable to interpreters. I hope that you are able to register online. The registration is open. Thanks to the platform that we'll be using, it allows up to 5,000 registrations. So right now we're at around 400, so you still have time till October to register, although we will cut off registration in September. Please hurry. You can find this information on our website. For those of you who already registered to attend on site, I know you will have something that unfortunately the online attendees won't. We are planning a cake. We are planning to eat some cake and have fun after all these serious conversations and building friendships and collaborations for the future. So with that, I would like to ask if there are any questions, Carolyn.
Yeah, let me take a look. And I just wanted to say thank you for this presentation. It's gotten me even more excited to be part of the conversation on October 12th with you guys. And I encourage interpreters to register if they have not already. Let's take a look here at the questions. Let's see. There was somebody who had mentioned they had a question earlier, but I don't see them writing. People listening, if you guys do have any questions, I'll hold the floor here for a few minutes. If not, then we'll say goodbye and see Natalya at the summit on October 12th.
That's right. And I want again to thank you for the opportunity, because I also want to share that, preparing this event, if any of you ever participate in a preparing event, it's very engaging. It takes a lot of people. Our whole commissioner board is involved. We have several commissioners working on the ground. Some of the pictures that you've seen, it's one of our commissioners ideally went to the venue, took pictures. We're, trying to figure out right now what cake to order. I think it'll have to be a split, because I cannot give up chocolate, but I understand some people may prefer vanilla. So all these little things, and
there's a
shrinking this
lot.
button. So much goes into this.
It's like planning a wedding almost.
Exactly, and it's the same, feeling that you get excited, and we actually have more fun, I think, now planning it. I hope we won't be exhausted on the day of that.
Yeah, no, I understand. We do have a question about if we know if there's going to be another summit moving forward. I don't know if you guys know about that yet.
Well, that's kind of
it,
it's definitely an interesting question, because it is not a conference and it's not intended to be as such. We don't plan to be an annual event. However, based on the lessons that we will learn, right, and
right.
based on the changes the profession will see, we may have it, in 2 years. I mean, we'll definitely have it every 10 years. I can guarantee you that, right? But I hope it will be a little bit more often, but we haven't made the decision. We really want to see the lessons, and if it will help us actually do something afterwards. Because getting together, there's so many opportunities. We don't want to pull interpreters away from attending conferences that they could have locally. We don't want to compete with any of those conferences, but we feel that there may be the need for that. We also make assessment and see that maybe we should move just to online modality completely, especially like in a couple of years. I think we all will be ready for it, but I don't know, maybe wishful thinking. One thing that I didn't mention, actually, if you're wondering, this attending this event will, if you're an interpreter, will get you continuing education units, because we believe that this is a unique opportunity of participatory learning, where you will be actually actively processing things and participating in the discussion. So if you're attending on site, it will be 5.5 continuing education hours. And if you're attending online, it depends on which module you choose. As a passive viewer, where you can still type comments and questions, but you are not able to unmute your mic, that is 4 hours. And if you participate in the interactive roundtable discussions, that's also 5.5 hours. So and I'm a Russian. I like everything affordable. So the registration fee is $10. We did it, thanks to the sponsors, but also because it's 10th anniversary, 10 years of certification. $10 sounded like a good fee.
I saw that, the first time I looked at it, I was wondering if it was an error or something.
I know. I thought like, I need to spell 10 in brackets. It's just exciting that we have so much support that we're able to do it seriously at this.
Yeah, it's great. You've got so many people at the table from all the different all the different parts of the language industry. So it's really cool. We do have a couple more questions. So one of them is about the E2E certification. Just how much time is planned to dedicate towards that at the summit?
That will be one of the topics of the roundtable discussions, right? The future of the certification. And also in our closing remarks when our chair will be revealing to you certain new things with CCHI, that would be one of the topics. Because by that time, we won't have any results yet. It would be still not an appropriate time to really dive into dissecting it or discussing it. But this will be the time when we will be recruiting participants to take it, because again, we'll be looking for 300 candidates to take the exam. We'll hopefully, that will be the time when we'll be announcing it. But in general, the conversation about the lessons of E2E and whether it's a go and how we can, create that exam will be in 2020.
Got it. Okay, good to know. Great. Well, I don't see any more questions, and but if there are any that pop up, I'll send them along. Thank you again, Natalya. It's been a pleasure as always, and I'm really excited to come out in October and be part of this amazing summit. So
Thank you, Carolyn, and thank you everyone at Boost Lingo, and thank you everyone today for listening and attending. So hopefully I'll see you or I'll see you virtually. Have a good day.
you too. Thanks, Natalya. Bye.
Bye-bye.